On today's show, we'll be looking at several topics. First, we'll talk to Wake County Manager David Cook and Wake County Economic Development Director Ken Adkins about bringing new jobs to the community. Plus, we'll be talking to Wake County EMS leaders and a patient about Wake County's unique cardiac program that helps save lives. We'll also be talking to Ramon Rajano from Wake County Human Services. Wake County recently ranked first for the 4th year in a row in the statewide public health rankings. Later in the show, we'll be talking to Ann Burlingame for Wake County Public Libraries. She'll be here to tell us about the annual book sale as well as the very exciting programs for kids and adults coming up this summer at all the library branches. Finally, we'll be talking to Environmental Services about the ways that recreational waters are tested in the summer. Welcome to WakeGovTV. I'm Sarah Williamson Baker. One of the Board of Commissioners' priorities for the last several years has been creating and maintaining jobs in our community. Recently, commissioners participated in an announcement with MetLife. That company will be bringing more than 2,600 jobs to North Carolina, both in Wake and Mecklenburg counties over the next several years. Joining us today is Ken Adkins from Wake County Economic Development and Wake County Manager David Cook. Thank you guys for being here.
Good to be here.
Thank you.
Just a short time ago, we were together celebrating the MetLife announcement, bringing as many as 2,600 jobs to Cary and Charlotte over the next several years. What makes this area attractive to businesses like MetLife?
This is a great place to be, Wake County, and that's for a lot of reasons. One, we've got great weather compared to many of the northeastern places that we compete with. Secondly, universities, the quality of life. But I think for MetLife, most importantly, it was the talented people. This is going to be a center for global operations and technology. And those are the same reasons that brought in Fidelity, Credit Suisse, and Deutsche Bank. This is a great place to find very smart people at a reasonable price.
I think one of the neat things about MetLife, you mentioned the 2,600 jobs. Cary's going to get about 1,200. And these aren't average jobs. These are jobs paying at about $112,000 per job. So these are good, high-paying jobs. And I think Ken's right. MetLife looked at the quality of the workforce that's here in Wake County, in the Triangle, and have decided they want to make a big footprint in this area.
The county works closely with Wake Economic Development on all kinds of projects. And what things does the county do to really provide that support?
Well, I think there's several things, and Ken could talk about some of the different variables. What the county has decided is that we contract with the Greater Raleigh Chamber of Commerce, and we contract for Ken and his staff to do the economic development strategies and implementation for the county. And I think what that allows us to do is to take advantage of what we call public-private partnership. So they bring to the table the private sector piece. When you're using public money, that's the public side of it. And so we have this public-private partnership to do economic development.
David, frequently we hear that higher education and the access to those education opportunities helps draw people to the area, citizens as well as businesses. Can you tell us about the county's partnerships in that area and how that helps with economic development? Sure.
I think clearly one of our advantages in the Triangle is the access to universities and colleges. And you know, we kid about State or Carolina, but we have State, Carolina, and Duke as 3 large institutions in our area, and we all benefit from that. And then you just add in the numerous colleges, you know, in Wake County we've got a number of those, and it produces a number of graduates, and that's the skilled workforce that a lot of companies are looking for. So it is key where we are with universities and colleges, and we have partnerships with NC State University, just as an example. But I don't want to leave out the community college, because Wake Tech Community College is a huge benefit for us in the recruitment and retention of companies. And you know, sometimes we call Wake Tech a secret weapon, but they're really not very secret, right? They're a tremendous asset for our community. We just recently had the bond referendum, right, for Wake Tech that had 70+% approval rating. And so I think our community and our business community sees the benefits of Wake Tech in job training and retraining. And so, you know, our hat's off to Wake Tech. That's part of it too. So it's the community college as well as the universities and colleges that we have here.
Ken, looking ahead to the future, what do you see for Wake County's business community in the next few years?
It looks very bright to us. We've had a lot of project activity. MetLife is a good example of a company that looked at a lot of places. It's a global company that could go anywhere, and they decided to come here. We think with the talent, with the quality of life, quite frankly, with the solid local governments we have here. If you look at the AAA bond rating, there are many advantages available to companies coming here because they know it's going to be a solid environment. Folks want to be where they feel good about their future, and Wake County is one of those places.
Thank you both for taking the time to be here today. We really do appreciate it. For anyone at home that would like more information about Wake County economic development, you can go to raleigh-wake.org. There's also links to get to that page from our website at WakeGov.com. Nationally, 1 in 7 people who suffer cardiac arrest will survive. The odds in Wake County are better than that. We'll have a survivor as well as EMS here to tell us more about Wake County's unique program coming up.
Mom, can I have $1? I think my purse is upstairs on the bed. It's not here. Check the dining room. No, the upstairs closet.
Moms everywhere are finding ways to keep kids active and healthy. Get ideas, get involved, get going at letsmove.gov.
8 years ago, Wake County's EMS system introduced the first in a series of protocols designed to improve outcomes for people who suffer cardiac arrest in Wake County. Joining us today is Jeffrey Hammerstein from Wake County EMS. Thank you for being here, Jeffrey.
Hi, Sarah. As
well as Bobby Barlow, who is one of the survivors. You all have met before, is that correct?
We have.
Jeffrey, tell for people at home who may not know about cardiac arrest, can you tell us real quickly what that is?
Sure. It's a basic medical term for a very critical situation in which your heart is not beating or not beating effectively. And without treatment, a person is not going to survive that more than just a few minutes.
Bobby, you suffered cardiac arrest a couple years ago and you were treated by Wake County staff. Can you tell us about this experience?
Well, I had just finished giving the eulogy at my best friend's funeral when I walked over, sat down by the minister, and passed out. And fortunately, I had 2 sons there that had CPR training, and they kept me going until Jeff and his crew arrived, and they took care of me, and fortunately, I'm here today because of that.
Tell us about, you've learned a lot about EMS and bystander CPR since that day. Tell us what some of the important things are to improve outcomes like what happened in your case.
Well, one of the most important things is to emphasize to people how important it is to get CPR training, because you never know when you're going to have the opportunity to save a life, and it may be somebody very close to you. The other thing that I try to always emphasize is how much support we need to be giving to the EMS people. Your first encounter with an angel may very well be somebody that arrives on a big loud truck with red lights flashing all over it.
Jeff, Bobby mentioned that he was treated on the scene. How are the treatments he received different than what happens in other places in the country?
Well, Sarah, in order for someone to do well with cardiac arrest and have a good outcome, there's like a whole domino effect of things that need to be in place. A couple of those components that we have here include the constant chest compressions. In addition to that, a treatment policy or protocol known as induced hypothermia. Now, what that actually does is when we get on the scene of a cardiac arrest, we're actually going to work to lower their body temperature just 3 or 4 degrees. When somebody's heart stops, obviously that's immediately critical to their survival. Strangely enough, when that pulse comes back with CPR, it actually is kind of dangerous and kind of hard on the brain and hard on the neurological system. What science has shown is that by lowering that temperature just a little bit, it makes that transition back into circulation through the brain, et cetera, a little smoother and a little less damaging. Once we start that cooling, the hospital will continue that for 24 to 48 hours and then slowly bring that body temperature back up. And we found with that introduction of induced hypothermia that survival with a good outcome, people who were then leading a life as effective and fulfilling as what they had before the event, that rate really started to increase after that.
Turning to our community, people in the community hear about bystander CPR. How do you learn about CPR and what kind of training is available? How do people go about getting more information about that?
There is training everywhere. Just a quick search of CPR and learn CPR, and maybe even searching out hands-only CPR. One of the things that's different about the way we teach community CPR now is that the focus is on hands-only, or the chest compression portion of CPR. I think a lot of people have traditionally been very afraid of the breathing part, afraid of whether that's dangerous to them, afraid of not doing it right, and even being preoccupied with the breathing. When you dial 911, those telecommunicators are going to give you instructions on how to do the hands-only CPR, and it's a matter of doing those chest compressions and doing them without interruption. Another thing that we find is that the interruption in and of itself is very detrimental to the outcome of the patient. We mentioned just a moment ago the dominoes. That most important domino is that first one, and that's bystander CPR. We've got to have that. We've got to get that going. EMS, fire department, we're coming as quick as we can, but those first few minutes are crucial for that person.
And again, about bystander CPR, you said your sons had training, and what difference did that make for you?
Well, it probably, as Jeff and some of his coworkers told me that could very well have made the difference in me being here today and not being here today, that probably my two sons knowing CPR and happening to be there with me at the time probably was a major factor in saving my life.
It's a tremendous story. Jeffrey, each May you celebrate EMS Week. Mm-hmm. You want to tell us a little bit about what's coming up this year?
Yeah, absolutely. Again this year, we'll have our celebration for the cardiac arrest survivors from the previous year. Again, those numbers jumped up, and we want to make sure that we invite them in, let them tell their stories. One thing that is so good for us as responders to hear and see are that these real people, not just patients, not just chart numbers, but real people come back and tell their stories and let us know that they're real people. They're not just numbers. And that's always good and fulfilling for us. And there's some pretty incredible stories, so we're happy to have them back.
All right. Thank you both for taking the time to be with us. There's more information on our website, WakeGov.com, about EMS Week. Coming up next on WakeGovTV, we'll talk to Human Services Director Ramon Rajano about the recent North Carolina health rankings. Wake County has a lot to be proud of, and he'll be here to tell us about it.
So, I'm kind of new here, but I've noticed a trend. My human does this funny thing where she goes around and gets all my toys, and then she hides them in that basket by the door. It's like, hello, that's where you put it last time. You were the worst at hide and go seek.
Wake County was recently ranked the healthiest county in North Carolina overall for the 4th year in a row. Human Services Director Ramon Rajano is here with us now to talk more about the programs and the ways of serving the community that make this distinction possible. Thank you for being with us, Ramon.
Thank you for the invite, Sarah, and congratulations on a great show that you run here.
Let's start with the healthiest county ranking overall. What group did this come from, and how do they make these determinations?
Well, the whole organizations in public health in the country for several years have been looking at ways that you could develop a scorecard so everybody understands what the indicators are. And then the University of Wisconsin, with money from the Robert Wood Johnson Foundation and other governmental entities, joined together and developed the health rankings that measure 30 different categories of health and divided in 5 different groups. But something very important to know is that when they talk health, they define health in the broad concept of health. It's physical, emotional, and social well-being. So it's going to measure indicators that have to do with mortality, with healthy behaviors, smoking, but at the same time, it tells you how many physicians you have in your town. They count averages, and they count a bunch of social indicators like children's poverty or single mother households or attendance to college. And so they count those things and count also environmental issues like quality of water and quality of the air and things like that.
So talking about healthy behaviors, Germain, what things are included in that category?
Well, it's many things that have to do with living a healthy life. For example, keeping your weight down, walking, physical activities, not smoking, and whenever it's these intimate relationships, really having healthy practices in intimate relationships. Those are some of the top healthy behaviors that we talk about.
And then the clinical care, you mentioned that there's some factors on there about the physicians in our community. Is that the clinical care section?
Yeah, actually we do pretty good in some of those indicators. It's like, for example, we rank very high, and we beat the national benchmark in the number of physicians and the number of dentists per groups of people here in Wake County. Those are very good, and that's kind of thanks to the private community that help us with that indicator.
One of the other indicators is the social and economic factors. And there's been a lot of human services programs focused very specifically on those things. How are those things making a difference here?
This is what is called now, if you look at something called Healthy People 2020, this is kind of the national guide for public health in the country. They targeting right now what is called social determinants of health, because they have realized that poverty or not attending college or unemployment are social factors that influence health conditions. So this is called healthy social determinants of health. And when you look at some of the things that are there, like children poverty, well, there's been a lot of activities, like we have human capital development programs. We're trying to move people to the middle class in the Middle Class Express. The county commissioners have been very excited about this one, so many partners in the community are helping. That helps improve the social conditions of the county. And then, you know, Sarah, this is a very intellectual county. This is actually one of the most, it's been ranked as one of the most intelligent counties of the country because the number of college graduates that we have here. So we have like, we go above the national benchmark in how many people have a college degree or attend college. This is a privilege here that help us also with the rankings.
The last category is the physical environment, and you said earlier something about recreational facilities.
Yes, yeah, we got good rankings in access to recreational facilities, and also we're above the state average in access to healthy foods. We still have to do better in some of those healthy food issues, and then the other matter is that because we are a metropolitan county now, we have a lot of traffic, so that's affecting a little bit the quality of air.
A lot of these things, a lot of the programs that are happening in human services rely strongly on partnerships. Are some of the partnerships out there also contributing to this great health ranking?
Well, I really have to say, I know people have been congratulating me and my department, but this is not only us. This is an orchestra, as I call it. It's really a great orchestra in Wake County. We have 4 amazing hospitals that work very closely with us. We have a great coalition in health that is called AHA, which is Advocates for Health in Action. We have the pleasure of having John Rex Endowment, a health foundation that many people don't have a health foundation in their county. So that's a blessing. We have a great school system that helps us with graduation rates. So I will say, Sarah, we kind of groupies. We like, you know, the covenant. It's like a covenant, and together we make it better.
Thank you, Ramon. We'll have you back very soon. There's a lot of fun things coming up at Wake County Libraries this summer. We'll hear more about the programming as well as the annual book sale and Family Fun Festival when we come back.
NFC, AFC, offensive linemen, defensive tackles, quarterbacks, and cornerbacks are all living united to ensure the academic success of millions of kids in our communities all the way to graduation day. But that won't happen without you. So take the pledge at unitedway.org. Make a difference in the life of a child. Suit up like your favorite NFL players and become a volunteer reader, tutor, or mentor with United Way.
When it gets warmer, many of us start thinking about books. The Wake County Summer Reading Program and annual book sale are both right around the corner. Ann Burlingame here from Wake County Libraries. Thanks for being here.
Thank you for having me.
In May is the month of the book sale.
Yes.
Tell us what is planned for that this year.
Well, the book sale will be May 9th through the 12th. And what we've done with the book sale is change it from being just a way to sell books to being a festival and a family experience. So now we're calling it the Book Sale and Festival of Reading. And we will open on the 9th and we'll be open Thursday, Friday, and on Saturday is Family Day. Because what we found is so many people brought their children, but there wasn't a lot for the children to do. So we have the entire day dedicated to children. We'll have crafts, we'll have entertainment, we're going to have music. So it's just going to be an exciting day.
The Family Fun Festival is new, and people always ask, what are the hours for those events?
Well, we will open at 10. Actually, we've kind of standardized the hours, so we're going to open at 10 every day of the sale, and we'll close at 7 on Thursday, Friday, and Saturday, and we close at 5 on Sunday. So the festival for the family really is going to run from the morning to probably late afternoon. And the one thing I did forget to mention is that we are going to have a craft this time about make a Mother's Day card for your mom, because you know Sunday is Mother's Day.
That is perfect.
Yeah.
That will be helpful to so many kids.
So many children.
After the book sale, libraries move straight into summer programming. Can you tell us about the summer programming for this year?
Well, this year we are offering 4 summer reading clubs, because what we've decided to do is to divide our summer reading clubs up by population. So we will this year have, for the first time, a Read to Me club for the young child. And that club will be just really promoting parents reading to their children and reinforcing those skills we teach in Every Child Ready to Read. Then we're going to do the school age program, which is called Dig Into Reading. And every week we'll offer, programs in conjunction with the summer reading club. Then we're doing a teen reading club, and we're also going to do an adult reading club.
So other than the reading clubs, anything else going on at libraries this summer?
Well, with our programs, what we've decided to do is we're going to add a school age program every week. So we already do about 2 programs a week for the school age child. We are going to add a special kind of extravaganza called the School Age Super Special. And this will be performers. We're going to have magicians, we're going to have crafts, we're going to have storytellers, because we're just trying to kind of create an experience for children that are out of school, that you want to come to the library in the afternoon, and this will be kind of a drop-in event, and there'll be lots of fun.
And thank you so much for joining us today.
Thank you for having us. It's nice to see you.
You can find more information about our libraries at wakegov.com/libraries. The libraries are also big users of social media. They're on Facebook, Twitter, and YouTube. Recreational waters are open in the spring and in the summer. Wake County has a testing program designed to provide you with the information you need to stay safe and plan ahead when you're visiting our beaches or recreational waterways. We'll have more about that program in just a moment.
Can you concern with me? Imagine what you'd see if every child had a book to read. So the mission is for us to get a book to each and every child. So let's join hands, book people unite. Unearth hidden passion. Come on, we'll have a good time. One book can be the first thing that helps to change a life. Book people unite.
Read to a child today and spark a lifetime of ambition.
Recreational water illnesses have become more common around the country the last few years. Catherine Hobby joins us now from Environmental Services to tell us more about the program.
Yeah, thanks for having me.
So let's start by telling us, what is a recreational water illness?
Well, these illnesses can exhibit themselves in a variety of different ways. The most common is diarrhea. Also, skin or respiratory infections and irritations can occur. These are all caused by microorganisms such as bacteria like E. coli that are naturally present in the water that we swim, boat, and fish in.
So Catherine, how do people get sick from E. coli in the water?
Well, the E. coli and many bacteria and other microorganisms are naturally present in all warm-blooded animals' guts and the subsequent stools. Humans, deer, geese, dogs, and through the rain and runoff process, these germs enter the fresh water that we swim and fish in.
So when people go swimming or fishing in water that's contaminated, how do they become ill?
Well, if you have any kind of contact with the water or accidental ingestion, you could potentially become sick.
So Catherine, what is Wake County doing to help keep our community safe?
Well, our beach monitoring program aims to regularly sample and inform the public. We take weekly water samples of the public swimming beaches and some local camps between May and September. We test for E. coli and Enterococci bacteria. The EPA has set limits to the levels of which these bacteria can exist, so that's what we sample. We test regularly between May and September during the high volume months, and we test at all the public beaches at Falls Lake as well as some of the private camps where there's kids playing in ponds or lakes like that.
So tell us what happens if a sample exceeds the EPA limits.
Well, then the county immediately closes the beach. We close it for the activities where you're likely to have a high contact or ingestion, such as swimming, but the area will remain open for boating and fishing. Once we close the area, we immediately begin daily resamples. When we have 2 samples taken 24 hours apart and that do not exceed the acceptable limits, then we can reopen the beach.
A really important point for folks here is that if the beach is closed for swimming, they can still participate in other activities?
Absolutely, absolutely. We just want them to be informed of the higher risk activities where they have the most of their body in the water or a likelihood of ingestion.
Is there a place that people can go to find these results for themselves?
Absolutely. Please check the website at WakeGov.com. We immediately post any openings and closings of the beaches. We have all our monitoring data there, as well as lots of healthy swimming practices, which we really encourage people to employ. These include, don't drink the water. It would seem pretty obvious, but please don't drink the water. Wash your hands with soap and water before eating. Make sure you rinse your body off. There are showers available at lots of these beaches. Rinse your body off before and after entering the water. This could eliminate a likelihood of an irritation under your swimsuit or your shoes. And if there's anyone in the party that has a weakened immune system, to always check with their healthcare provider before swimming in fresh water.
Thanks for joining us, Catherine. Anybody at home that'd like to learn more about the programs Catherine mentioned can visit us online at WakeGov.com and look for the Environmental Services Department. That's it for our show today. Thank you again for joining us here on WakeGovTV. Keep up with the latest Wake County news at WakeGov.com/news. You can also find us on Facebook and Twitter, as well as YouTube. We'll see you next time on WakeGovTV.